I'm chairman of TER Policy Center, which is a not-for-profit organization. I was a former, I am a former director of United Nations Environment Program, where I spent nearly 20 years. And before that, after my graduation in IIT Bombay, uh, I was in a number of private sector companies, including Tata Chemicals. So I'm by profession engineer, and today I will be talking to one of the star professors in medical science. So it is going to be a very rare occasion that I will be moderating and dialoguing with the medical professors and researchers. So the engineer dialoguing and interviewing the uh,
Hey,
medical professions is itself is a unique moment, but it is a challenge for me. So in case I make any mistake in asking you a question or commenting, please do alert me saying that you are speaking an engineering language and not a medical language. So thank you for your understanding. I would like to welcome all the participants, of course, the speakers, experts, uh, and would like to wish Happy World Health Day. I know you need those best wishes that by health wise we should be happy today. Unfortunately, the pandemic has made us sort of a gloomy atmosphere and the ecosystem everywhere. There are hardly any regions which are spared by the coronavirus, and COVID-19 pandemic is really taking its toll. Let's see how we go ahead. I would like to specifically now welcome uh, Dr. Chandrakant Pandav, then Dr. Punit Misra, and Professor Amitav Banerjee. And these three stars today, we are extremely fortunate because they are all connected to the very prestigious medical institutions, AIMS, AIIMS, as well as Dr. Banerjee comes from a rich experience with Indian Army, and now he is serving in a DY Patil College of Medical. Let me make a beginning by making some general comments. We are in an extremely strange position today. As a humanity, we take a pride in saying that we know everything what is happening in the sky, on the land, and in the sea. But a very tiny or nano virus has made us humble. That virus has made us think or have made it realize that we know what we don't know. And this is a very important thing because we are living with virus for more than 1 year and we really don't know what that virus is. So we are all humbled. We had a great digital and technological ego, which has made now this virus absolutely humble, torn, broken up, and totally damaged. Our ego is damaged. Because even today, we don't know how this virus is behaving. And I felt that these experts today, three of them, Dr. Misra, Dr. Banerjee, and above all, Dr. Pandav, will probably tell us how long we should remain humble like this and how far or how time wise we would keep on saying that we know what we don't know. So let me first welcome Dr. Chandrakant Pandav to say a few words. And I will put some questions in my introduction so that Dr. Pandav can address that. But before that, let me tell you about Dr. Chandrakant Pandav. He is a former professor and head of the Department of Center for Community Medicine, that is CCM, at All India Institute of Medical Sciences, AIIMS in New Delhi. And the most fresh news is as if we have taken a cake out of oven and how it smells. That latest information about Dr. Pandav is that he has been conferred with the prestigious Padma Shri Award in 2021. That is nearly 1 year after the coronavirus appeared on the horizon. He has an exceptional and distinguished service in the field of medicine. And on top of it, he is known as an iodine man. Because he is the one who took up a nutrition challenge to make sure that our young generation and particularly women are not deprived of the iodine, which is so much required to maintain our level of nutrition. And today we are going to talk about how this nutrition is connected with COVID-19. I'm sure all in the audience know that unless our immune system is strong, we won't be able to fight with coronavirus just by mask or just by maintaining social distancing. I think those are external factors. But the internal factor is, and we know that we have to keep our body in a good shape, not only but also in terms of whether we have those essential nutrition elements. So, Dr. Pandav, I'm sure I have introduced you with some key items or key dimensions. But if I start telling about you, probably it will take the whole of our dialogue into it. So I'm just putting some of the key factors in it. And now the question is not only that we are in a hot spot in Pune or Mumbai, but we are in a boiling pot. It is like a lava spot of pandemic. So your views on how the nutrition plays in building the immunity and how it will play in the coming days as far as the variant and muted coronavirus is concerned. So floor is yours, Chandrakant Pandey.
Thank you very much. My esteemed elder brother, Dr. Rajendra Shande, आप तो हमारे बड़े भाई हैं, sir, बड़े भाई. My esteemed colleagues, Dr. Puneet Mishra. In fact, it's very interesting. I was member of the selection committee when Dr. Puneet Mishra had applied for the post of faculty at AIIMS. And we're so proud that that you made it to the faculty member of AIIMS, and you're doing some outstanding work in this area, especially in non-communicable diseases. Amitav Banerjee, my long lost friend, Kumbh Mela mein kho gaye the. तो Kumbh Mela mein kho gaye the. He is exceptionally brilliant and he has got such exciting writing skills. He's not only very good in speaking, but he actually his word is mightier than the sword. Pen is mightier than the sword. He's a classical example. Amitav Banerjee. Hey, Babu Mashai. Namaste, namaskar.
Thank you, sir. Thank you. You are my guru, sir. You are my guru.
सब एक दूसरे के गुरु है. All of us are learning from each other. You know, Dr. Shende was very polite when he said he is an engineer, but he is a social engineer. People don't know he's a social engineer, so he's very sharp in his asking questions. First of all, I would like to express my gratitude to the Corona warriors, the physicians, the nurses, the supporting staff in the ward, the drivers, the security personnel, and implementing agencies. सबसे पहले मैं आपको धन्यवाद देना चाहता हूँ. शुक्रिया, शुक्रिया, शुक्रिया. You're putting your own life into, you're writing what I call the valley of death, the poem I learned as a childhood, valley of death, and you're sacrificing your life to protect the humanity at large. तो आपको सबसे पहले मैं धन्यवाद देना चाहता हूँ. Today is 7th April 2021, World Health Day. The first World Health Day was celebrated in 1950, and today's theme is fairer and healthier world for everyone. Fairer and healthier world for everybody. I wrote a piece in the Hindu Business Line expressing my views about today's World Health. Basically, the heart of the theme is equity, equity, equity. When you talk today of any topic, we talk of social development goals, goals for social development, and health and well-being comes as number 3 goal. But that's only part of the story. In fact, what's the focus is on social determinants of health. It's SDH as well. In fact, SDH contributes to 1/3 to 50% of health outcomes. I repeat again, social determinants of health contribute to 1/3 or 50% of health outcomes. So very important. Very interesting, Rajendra Bhai, that SDG, social development goals, then comes SDH. So they're maintaining the alphabetical sequence. G के बाद H आता है, God के बाद health आता है, G and H. Now I just want to give a broader perspective that the classical definition of the World Health Organization of health was given in 1948. The definition says health is a state of well-being. Health is a state of physical, mental, and social well-being, and not merely absence of disease or infirmity. Recently, I had a chance to speak on the holistic health, or what we call integrative health. And it has 8 dimensions of health, 8 dimensions of health. Physical, mental, social, emotional, intellectual, spiritual, environmental, occupational, and economic. 8 dimensions of health. And these are so relevant, especially in the current scenario, the pandemic of COVID-19. Now, coming to a specific question about nutrition and COVID-19. Before that, I again want to set up a context. When you talk of interacting with any disease, especially with COVID-19, there are external influences and there is internal resilience, I call it. External resilience is given by 3 things. By wearing a mask, what I call as face hygiene. Second is by hand washing. And actually, Rajendra Bhai, there are verses in Upanishad which tells you how to wash hands. I had the opportunity during this Corona period to study Ved and Upanishad. And I'll tell you, I'm shocked by the wisdom of the ancient ancestors. I'm writing a lot of articles which I'll be submitting to Dr. Amitav Banerjee on linking ancient wisdom with modern science. You'll be shocked that even the concept of physical distancing has been mentioned in the Upanishads. And I want to emphasize here, sir, Rajendra Bhai, it's not social distancing. It is physical distancing of 6 feet. Social distancing is the most asocial, antisocial, and horrible word that has been used. It has been blindly adopted from an anthropologist from United States of America. Social distancing in India means you are untouchable. So we are untouchables. That's the wrong word. And I made a public appeal to Honorable Prime Minister that his scriptwriter of the speech has made a mistake. So please correct it. It's not social distancing, it is physical distancing. Now let me come to the overall context. The Honorable Prime Minister launched the National Nutrition Mission on 8th of March 2018. 8th March 2018. The other significance of 8th March is that it's the World's Women's Day. A very important thing. And it was launched at Junjunwala in Rajasthan. The National Nutrition Mission has 6 objectives. Reduce stunting in children, that is from 0 to 6 years, at 2% per annum. Reduce underweight in children 0 to 6 years at 2% per annum. And most important, which is plaguing us, the reduce anemia in children 6 to 59 months at 3% per annum. And reduce anemia in women and adolescent girls at 3% per annum. And finally, reduce the low birth at 2% per year. Our Honorable Prime Minister, Narendra Modi, I consider him as a public health champion, not of the decade, but I consider him as the public health champion of the millennium. Honorable Narendra Modi, most grateful to you. He's the one who started Swachh Bharat. He's the one who started National Nutrition Mission. He's the one who started Ayushman Bharat. He's the one who is talking of Sashakta Bharat and Samruddha Bharat. So I just want to publicly acknowledge my Honorable Prime Minister Narendra Modi for taking some outstanding, exceptional decisions. So thank you so much. I'm available for any questions to ask later. I've just given a brief context, told you about the World Health Day theme of 2021, fairer and healthier world for everybody, where the focus of attention is equity. I told you about the ancient scriptures linking with modern medicine. I talked about the National Nutrition Mission. I talked about Honorable Prime Minister Narendra Modi as the public health champion, not of the century, but of the millennium. Rajendra Bhai, thank you so much for this opportunity. Dhanyavad. Dhanyavad.
Dr. Shinde, you're muted. Can you please unmute yourself?
Thank you, Dr. Pandav. That was amazingly short, brief, but rich in knowledge intervention by you. And you did answer that question very well. You called me a big brother. I think from the point of view of medical sciences and understanding that various terminology, I am probably the smallest brother of all of you. Two things which have come out. One is how wrong the word is social distancing. And second thing, he talked about probably the cause of malnutrition, that is equity. I think the equity in our society has created a number of issues which we are unable to tackle it fully, which is very sad. I mean, particularly the human beings which has such a large ego, knowing that the human beings are failing in number of instances globally and at planetary level, it is amazing that we still keep on harping on that ego. My second question will be to Dr. Puneet Misra. I remember in 2012, our former Prime Minister, Dr. Manmohan Singh, said that it is a national shame that 42% of our children in India are suffering from malnutrition. I mean, any prime minister talking about his own country and calling it a shame is probably the first instance. And he even elaborated it by saying that these are the children suffering from malnutrition will be tomorrow's scientists, tomorrow's farmers, tomorrow's engineers and doctors. And what kind of capabilities they would be having in order to tackle number of challenges, including equity. So with that background, my question to you is, as we prepare for the second year of COVID-19, which seems to be more severe and which seems to be more damaging, what could be our nutrition strategy so that we have an immunity not only towards coronavirus, which we identified in early 2019, but also its further generations, which in your medical language you call it variant, or you call them mutant, and also a number of other scientific names. So how we can face all this with our immunity arising out of nutrition? Dr. Misra.
Yeah, thank you, Rajendra ji, for inviting me to participate into this discussion, and I feel really privileged to have Dr. Pandav and Dr. Banerjee here, the great experts. Dr. Pandav was my guru, teacher, mentor, and then I got opportunity to work with him as a junior faculty member, and today I am speaking from a place which is called Ballabgarh, which is a rural center, and that was very close to Dr. Pandav's heart. I remember when I was here as a junior faculty member, he used to visit quite often, maybe sometimes twice a week or thrice a week. And not only he used to visit this center, but used to stay in this rural center. And recently I have taken over as faculty in charge here, sir. So I would be brief in my answers because there are two more meetings which are waiting for me. And coming directly to your question about the nutrition and its impact, the impact of COVID on it, as we know that uh, nutrition, and you have rightly quoted the statement of the then Prime Minister of the country about nutrition, and we know that if we talk about in terms of nutrition, whether it is macronutrient or micronutrient, we are not doing that good, and that's why Government of India, our Prime Minister, current Prime Minister Modi ji, he has launched Poshan Abhiyan. So that is one important issue. And now the question is that what is the impact of COVID? We know that COVID has affected all the wake of life, whether it is the employment, whether it is movement. So there are multiple factors. If we think in the terms who are mostly affected, with the nutritional deficiency, you were talking about the equity and other things. The people who are underprivileged, living in areas like slums or in the rural areas, and those people do not have the means to so those are the most vulnerable. And in the COVID epidemic, this pandemic, these people, they are mostly affected because many of them, they are not able to go for the jobs, or they have left their jobs, or those things have happened. So definitely it might have some impact on those people, though our government is trying to give the free ration and trying to supply. But yes, as we have seen during pandemics, the nutrition is one thing which is mainly affected. So so because of the supply chain, because of the impact of the people not getting the adequate employment, and other things where a lot of government machinery is moved for the controlling COVID pandemic. So these all these things, they are going to affect the nutrition program. And I think despite of the effort of government, despite of the effort of governments, sorry, despite of the effort of government, it is going to hamper our efforts towards the nutrition. And there comes the, I think there comes the role of non-government organizations and other organizations in their area, so that at least if they can focus on the nutrition of those who are under 5 and those who are pregnant ladies, because the pregnant ladies, as you know, that more than 50% of these females in our country, they are anemic. So there is a double burden. They are anemic, they are pregnant, and this is the COVID pandemic. So at many places they are not getting the adequate services, whether it is in terms of ANC and other things. And if they get malnourished, it would have impact on the future generations as well, which you were pointing out at that time. And now we all know that the effect of malnutrition, it is not only on on immunity or on infectious diseases, but now it is very well established that if there is a malnutrition, especially intrauterine malnutrition, it may lead to things like diabetes in the future life, right? And many other diseases. So I think this is an important area which we should focus for our future generations, where we can provide some kind of nutrition and some kind of services to our ANC females and under 5, though government is trying their effort. And with these words, I would stop my talk over here. And Dr. Pandav, I think you want to say something. So thank you. Thanks.
Rajendra bhai, if I may make a small statement,
Just a minute. I understand that Dr. Punit Misra, he has to leave for another review meeting for which he is in charge of it nowadays, about reviewing the situation, what is existing in the country. So Dr. Misra, you still have a time, you can listen to Chandrakant Pandav, but I would like to thank you for taking some time, at least in the beginning, and delaying the meeting. I won't say delaying the meeting, but requesting your colleagues in the meeting to wait for some time. And I appreciate your gesture to come here in time. Thank you very much.
Thank
But
you.
I leave it to you whether you want to leave or go for the meeting. Thank you. Yes, Dr. Pandav. Yeah. You are muted.
make a very brief statement.
Okay.
Honorable Prime Minister Manmohan Singh said that 40%, 44% of the children are underweight. Recently, I met Honorable Smriti Irani, the present Minister for Department of Women and Child Welfare. I told Madam, we must improve our reporting figures. We never report that 56% of the children are adequate weight. Why are you reporting it negatively? Why are you saying that 40% are underweight? The glass is always half full. And I've requested her in writing that the indicators reporting should be positive and not negative. Thank you very much.
Very good. That is a positivism. Thank you. So we are now going ahead with our what is called as a dialogue, which could be understood by all of them irrespective of their background, and would like to talk to now Dr. Amitav Banerjee. I mean, what we heard from Dr. Misra is about many advices are being given how we should breathe through the mask and in which area and how far physical distancing we should keep. Then we are talked about not only what we should breathe, but also what we should drink, the hot water, and in what quantity and what time. All those things are being prescribed. But hardly there is any advice which says what we should eat. Of course, we are told about we should eat some medicines and some of the herbal medicines. We are told about it. But when we talk about what we should eat, we are talking about filling our stomach or being judicious in what we eat. So I think that is a topic we are talking about. And my question to you, Dr. Banerjee, is what is the advice that you will give it to the college students? Saying that now most of the time you are out of the campus, but then that's why you should focus on that kind of food so that not only your immunity is level keeps very high, but also it will help you in furthering the cause of our Prime Minister Modi's statements of making a smart India, making Swachh India, and stand up India, and those kind of things. So let's focus on what advice on what we should eat to the young people who are between, let's say, 16 to 24.
Thank you, Dr. Sinde. That's a very good question. And this, to drive home this point, I give an exercise to all the college students I have been talking to for the past year. I have been noting the different mortality figures across different continents, and a very peculiar pattern has come out. I had tabulated the deaths per million from COVID with the obesity or the overweight, high BMI beyond 25, with the overweight percentage of different countries. And I have found most of the countries like Europe, USA, and all the European countries and USA, the overweight percentage is above 60%. Whereas the Asian and African countries, the overweight is just 20%. So they are 3 times overweight and they have about 10 times more mortality. And the age also, of course, age, we used to think earlier the age is high, But Japan also, the exception proves the point. Japan has got the highest life expectancy. Japan age is higher than the Western countries also, but their mortality from COVID is like Asian countries, 10, 20 times lower than the Western countries because their overweight ratio is just 23%. Then India is also 20%, Africa 20%. In Africa, there are two countries like South Africa and Egypt, which has got almost 60% obesity, and their mortality is also higher in Africa. Similarly, Japan also with low obesity, the mortality from COVID is less. And then I was curious, the Brazil is having the highest mortality. And I checked up the obesity from the WHO figures, and their obesity overweight ratio is almost touching 60% like Western countries. So this overeating, particularly fast food and all young people, sugar foods, then soft drinks, this one should check in the short term. Overweight, obesity is coming out as a very high risk factors for the respiratory mortality and morbidity from respiratory illnesses. So we have got this advantage, and I tell the college students to tabulate different countries, the rate per deaths per million with the available in the worldometer and WHO side with the overweight rates. So in the short term, we should have healthy foods, keep a check on our BMI, on our weight, exercise, and of course sunlight, diet and all that. And this lockdown is increasing the overweight ratio because people are not going out, people are not exercising. Similarly, as Dr. Punit Mishra said, in the long term, undernutrition in poor countries will give rise to diabetes and other metabolic syndromes and other things in later life. So that would make them vulnerable from communicable disease. So in the long run, we require proper to avoid undernutrition. In the short run, we have to check the overnutrition and healthy foods rather than junk foods, these fast foods. So I think this is a message would I like to give to all the college students. Control the junk foods.
That's great. we never got any advice from anywhere, and Dr. Pando can correct me, saying that what should be the diet, normal diet during the COVID-19. At least I have not seen it. We are talking about herbal medicines, we are talking about some old methodologies, and we are all proud of our past, that how the various herbal medicines have come up and concoction has taken place. But we never have what is called as a COVID-19 diet. And I don't know whether yourself, Dr. Banerjee, or Dr. Panda can come out with the ideal diet during COVID-19.
Anything which can avoid high calories, and particularly the sugar, particularly now young people are very fond of this soft drinks, which has got a very high sugar content, which gives a kick, and it leads to obesity and overweight. And of course, a healthy diet with proper meals, proper timings, according to the culture. And our the Indian diet is pretty good and pretty healthy. Our Indian diet of cereals, vegetables, fruits, at least 5 helpings of fruits are suggested. So I think Dr. Panda will further add to it.
Yes. You are muted again.
First, I would like to give share with you some exciting quotes given by the towering personalities. The first one is Hippocrates. As you know, when you graduate, we have to take the Hippocratic oath. What does Hippocrates has to say about food and medicines? You mentioned Hippocrates, to quote him, "Let food be thy medicine. Let food be thy medicine, and medicine be thy food." I repeat again, Hippocrates said, "Let food be thy medicine, and medicine be thy food." That's Hippocrates. Now let's come to the United States of America. What does Thomas Edison has to say? Thomas Edison is quote on food. "The doctor of the future will no longer treat with the human frame with drugs. The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition." I repeat again, the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. And more recently, our at least my hero in the industrial world, Ratan Tata, what does he have to say? Eat your food as your medicines. Eat your food as your medicines. Otherwise, you have to eat medicines as your food. What outstanding quotations by all the three luminaries, three people I respect a lot. Now, coming to the very specific answer to your question, I mentioned earlier that linking ancient wisdom with modern science. Rajendra Bhai, I had a chance to study my ancient scriptures once again. And being Pandav, I know Bhagavad Gita pretty well. I'm a student of Bhagavad Gita. I call it as Jivan Granth. Now, there are verses in Bhagavad Gita which tell you what kind of food you should eat. There are verses in Upanishad as to what kind of diet you should have. I just want to emphasize this point again and again. The ancestors were not only wise, but very smart and very scientific. There are three kinds of people when it comes to wisdom. There are three kinds of people: those who are wise, those who are otherwise, and in India there is a special category, those who supervise. Wise, otherwise, and supervise. That's typical for India. Now, what I want to say is, my esteemed colleague Amitabh mentioned, first is the discipline. What food? Actually, this eating 4 times a day is a British concept, and I'm not very fond of Britishers at all. Lord Macaulay, 1836, he introduced English language in the Indian system, and he made India English positive and English negative. Corona positive and Corona negative. So I'm not very fond of Lord Macaulay or British system, which has imposed in the last 200 years. I'm a public critic of that particular unfortunate event in the history. So actually, if you look at Indian tradition, we have to have meals only 2 times a day. You remember, Rajendra Bhai, when we used to go to the school in Jivan Shikshan Mandir, we used to have our lunch at 9:30 or 10 o'clock, have a small snack at 1:30 or 2, and come and have an evening meal before 7 o'clock. So we have to go back to the ancient practice that you and I did as a child. That's number one. Reduce the frequency of your food you eat. That's number one. Your lunch at 9:30, 10, your small snack with fruits or sprouts at 1:30 to 2, an evening meal before 7 o'clock. And I'm so proud that in my Jain brothers, they practice this one. They eat their dinner before the sunset. So what a plethora of ancient practices we have in India, which we have never practiced. That's number one. Number two, reduce the wheat consumption. Wheat is another cancer that has been introduced by the Britishers. I'm so sorry to say that. Wheat is another carcinogenic diet. I have an ambassador, Milka Singh is the brand ambassador of a recently launched World Non-Communicable Diseases Federation, NCD, and I'm the mentor of that group. Milka Singh is the brand ambassador, and your younger brother, Chandrakant Pandra, is the mentor of that particular group called World Non-Communicable Diseases Federation. There are 2 kinds of teachers I met in life, those who are mentors and those who are tormentors. So what did you see? I'm a mentor of the group. And we have written to the Honorable Prime Minister that on 17th September, we shall start a global movement on NCDs. So discipline, reduce the frequency of meals. Now, what is the content of the food? Get out with the wheat. Stop eating wheat. Eat jawar, eat bajri, eat nachni. These are our own food crops which have stopped looking at it. I come from Mohol in Solapur, and Solapur district is famous for jawar. उनको तो बोलते हैं ये तो मोती के दाने हैं, मोती के दाने हैं जवार. उसको back to big back to the plate, jawar, bajra, and nachni. Get out, quit India. Quit India. That's number 2 in terms of content. Number 3, green leafy vegetables. Start having a home garden. Start having a community garden. And the classical example is Shevgacha Shenga. You have a drumstick. What a rich source of iron it is, drumsticks. I'm not drumming about it, but drumstick is very rich source of iodine, a rich source of iron. So start having drumsticks. Go, these things, drumstick tree doesn't require. I'm talking to an environmental expert. Apologies for that. Drumstick is a very friendly tree. It grows everywhere and anywhere. So promote drumsticks. Number 4, try to have fruits that you can afford. Try to have the fruits. And Maharashtra has done extremely well in horticulture. We have caused a revolution of fruits. I begin my day with having fruits because that way I have a fruitful day every day. I start my day with eating fruits so that I have a fruitful day every day. And next is about the water. Water, drink plenty of water and frequent. But don't drink water with your meals. Drink it after half an hour after your meals. Half an hour. Now we're getting into summer, drink plenty of water. And if you are required, try to add nimbu or kakadi to that. With that, what I do every day is, before going to sleep, I keep a water in a jug, cut small pieces of lemon and add kakadi into that, cucumber. I'll make it ferment overnight. So in the morning, the whole day I drink that particular water. It's alkaline water. It is excellent recipe for acidic personalities that we all have today. Alkaline water. So in brief, I told you very interesting story of what to eat and excellent quotation by the luminaries, my heroes of life, Hippocrates, Thomas Edison, and Ratan Tata. Thank you very much. Thank you.
Very, very good. I think we are learning what to eat. And at the same time, we are also learning the new language that you are speaking on Ratan Tata, that eat your food as if it is a medicine. Otherwise, you will keep eating medicines like a food. Very true, very true. But Dr. Banerjee, we have been hearing all this, leafy vegetables, eating jawar, reducing wheat, as a sort of a principle of dietary practices. But when now we are in absolutely unprecedented situation, and knowing that we are now ready to do whatever you experts will say, because even vaccines are in doubt, the medicines are also in doubt, because the virus is mutated. The virus is becoming variant and is producing a generation which we even don't know is a genome sequence. So we are totally in a dark era. I mean, which era could be darker than this? Really think of. I mean, just because I'm talking to you, I feel great about it because you are the experts and I'm asking a question like what the naive student will ask the professors. But knowing that now the life is going to change, the online education, online professionals, not going to the office, doing everything from home, whole the lifestyle is going to get changed. So in that, do you think there is a need to be very specific in telling, okay, in a changed circumstances, this should be your diet? Or you think that people are still fighting the coronavirus and they don't have time to advise what we should eat? What is your view on it?
This can be used as an opportunity. In fact, we have already got an advantage. As I said, our average BMI is 1/3 compared to the Western countries, and probably that's why we have got very low mortality, 1/10 the mortality of the Western countries. So this is the time, as we call it in preventive medicine, primordial prevention. Like, do not adopt those cultures, like as Dr. Pandav said, preserve all Indian culture.
हाँ वो तो बोला कि शाम को किए थे रात में.
Primordial prevention that preserve our culture, which is beneficial, and I think the young people will understand it if, as I said, if we show them the data that it is a leanness which can give you some immunity, and of course they can also monitor their weight also and do some exercises. In fact, nowadays there are a lot of indoor exercises they can do, indoor cycling or indoor some exercises, and Diet should not be, I mean, once they know, of course, it's difficult because nowadays there are a lot of birthday celebrations, other thing, cakes and sugary cakes. And another thing, like fruit should be taken, but people substitute fruit juice for food, fruits. So fruit juice is dangerous because it has a high sugar content. So this education has to be given to the young people. So I think we can make some education material and distribute among college students. We can have some seminars by the students. I mean, involve the students to educate others and the community. And I think it can be because already we have got a tradition, and now the people are turning towards the Indian tradition. They are coming of age, and I feel the newer generation is more confident. And our generation used to mimic the Western cultures and other things. But I think the young generation is more confident about their own Indianness or their own culture. So we can use that, I would say, social engineering methods. Social
Yes, I like it. The whole thing now turns into me, but I think we take your advice fully. We take Dr. Banerjee's advice, and we will work under the guidance of Dr. Pandav to prepare what is called as a guidelines for a diet
and
related
give them the
issues.
data. I have got very vivid data. If we collect the data, you just eyeball the data. No complex models are required. No complex statistics required. Just the data shows direct obesity rates and the mortality rates. Obesity rates and mortality rates. So the young people are
Right.
quite intelligent nowadays. I have interaction with young students. They are very ready to pick up these things.
Very good. Very good. So it is one conclusion of our dialogue is already done. And now we will get probably a second conclusion from
Obesity
Dr. Pandav.
epidemic is on us, particularly growing economies, like particularly the middle class. Indian middle class,
Right.
and they are using motorcycles, scooters, cars. They are not going out. Vitamin D deficiency is another point. We carried out a study a couple of years back in our institutions. We found the students are having the lowest vitamin D level compared to the faculty because they are not going out and exposing themselves to the sun and other things. So they had very low levels of vitamin D, and which again has got some connection with immunity.
Right. Very good observation there. Yes, Dr. Pandav.
Well, I want to make a public commitment, Rajendra Bhai here, that we shall come out with an operational manual in terms of diet and nutrition in COVID-19. I'm rather shocked that nobody asked this question. That's what an engineer does. Engineer practices, we only preach. Engineers build bridges. That's what you did. So this is going to be a very monumental, historic webinar, sir. Rajendra Bhai, and we'll come out, Amitabh and myself will come out with a guidelines about diet and nutrition in COVID-19. That's number one. Number two, we talk of evidence-based medicine, not eminence-based medicine. Amitabh has introduced a term called eminence-based medicine. We talk of evidence-based medicine. Yeah, Amitabh is a wordsmith. I know silversmith, I know goldsmith, but my esteemed Dada Amitabh is a wordsmith. He coined the word eminence-based medicine, not evidence-based medicine. That's number two.
Right.
Number three, I would suggest, I talked about external resilience and internal resilience. Ayush, back to Ayurveda, back to yoga, back to Unani, back to Siddha and Ayush, back to Ayush. I do yoga asana every day for 90 minutes, sir. 90 minutes. 90 मिनट में रोज करता हूँ योग आसन, इसलिए मेरी आवाज में इतनी दम है. And that's why I'm fresh even at the end of long day. Normally, these days I work for 12 to 14 hours and I'm still fresh because yoga. First, when it was yoga, we were always attracted by the Western world, you know. But I again come back to my Honorable Prime Minister Narendra Modi. 23rd June, he introduced yoga as an international United Nations Day योग. So प्रधानमंत्री, मैं आपको और एक बार धन्यवाद देना था. योगा, अरे हमारा योग है, योगा का है, हमारा योग है. Back to yoga. 90 minutes I do. Number two, I say mantra jap. I'm working on my paper on Om. E is equal to mc square. I'm getting to Einstein's equation. Om equal to E equal to mc square. And we should say Om 108 times a day. 100, and it should be done in 1 minute. You say it for 6 times. So each Om is said for 10 seconds and do it for 18 minutes. You say it for 108 times. Now 108 is a very special number in our scriptures. You know what is the scientific expression of 108? The distance between the sun and the earth is 108 times the diameter of earth. The distance between the moon and the earth is 108 times the diameter of moon. हमारे पूर्वज कितने महान थे, कितने महान थे, कितने पढ़े लिखे थे, कितने scientific है. So Corona is my guru. Corona taught me so many things in life. First of all, it took me back to my ancient medicine. And I'm linking with modern science, ancient wisdom with modern science. Number 3, mantra jap. Number 4, music. I'm a founder member of Indian Musical Therapy Association, IMTA. Where medicine fails, music heals. Next is dance. You know, dance, we have dance in our cultural practice. Well, all kinds of dances for all kinds of dance. Then what my Kabir Amitabh said, sit in the sunlight. We're so lucky to have sunlight throughout the year. Sit for half an hour. Next is, if required, take vitamin D supplements. So this is there. This is all written in my ancient scriptures, sir. Rajendra Bhai, ये सारे हमारे ग्रंथों में लिखा हुआ है. तो करोड़ों को मैं अपना गुरु मानता हूँ. गुरु इतना सिखाया. And coming to medicine, I just want to share my statement. What has been my philosophy of life? Very briefly, I want to tell you what philosophy of my life is. It is the following. My philosophy of life, I'll just take 2 minutes.
Yes.
Just 2 minutes, sir.
Yes, yes. Go ahead, Pandav. Go ahead. Hello, Dr. Pandav, you can hear me?
Yes, I can.
Yeah, go ahead.
Yes. Can you hear me?
Yes, yes, I can hear you. Hello, Atharva, you are able to hear me?
Yes, sir. Yes, sir.
Oh, okay. Dr. Pandav, have you finished or you want to take 2 more minutes?
I just wanted to listen to the song and then I'll finish.
Okay, okay, fine, fine. So I think one of the outcomes of today's dialogues is already done, that we are going to come with whatever the operational manual or guideline, and it is so urgently needed. Before probably the next education session starts, we should come out with that. But what I want to tell, that this dialogue has been so fulfilling, if I can use that word, knowing that we are talking about nutrition and diet. So it was so much fulfilling mainly for our brains, that I'm surprised that we neglected this issue and not talk much about throughout the last 1 year or 1.5 years. Now, time is almost over, but I'm not going to close it down without asking a very specific question to both of you. And probably we will have a chance to ask a similar question to Dr. Punit. Our fourth speaker, which is Dr. Sanjay
Rai.
Rai. Sanjay Rai. He couldn't be with us because he's on the way to Mumbai, because he's part of the central team to investigate the hot spot or the boiling spot of Maharashtra. And he really apologized to all of you in the audience that probably next time he will be better equipped, knowing that he has visited the hot spot or boiling spot, and probably share his knowledge about it. But the question which I want to ask Dr. Banerjee is, I won't say it is personal, but it is based on your experience. I'm sure the Indian Army, where you spent a lot of time, probably are dealing with the COVID-19 in a more disciplined way, because that's what they are brought up with, the discipline. So what do you think is Indian Army is getting affected in a similar way as a civilian, or you think that they are class apart and they are managing it well? And we probably can give an example of Indian Army to the civilians.
I left army almost 16 years ago, but of course I have been interacting with my colleagues in the army. So their problem may not be that acute because they are a younger population. So they have had some cases in the year, but the mortality and other things are not much in the army. Being young population, elderly ex-servicemen, they have been here. So otherwise, they are not the serving population maybe not much affected. And as I said, I wouldn't know, but they are good in implementing the COVID appropriate behavior and other whatever measures to be taken. So the implementation is good. That's all I can say.
Okay, okay. And then I come to the last question to Dr. Pandav. I mean, you are known as a iodine man, but I feel like telling you a term which I want to borrow from the history and say that you are an iron man rather than an iodine man. Iron man as far as medicine is concerned. I mean, not that I want to show that I can be as much wordsmith as probably you are, but my question is, iodine deficiency, to what extent it is promoting COVID-19?
Well, what happens in iodine deficiency, it affects your thyroid hormones. If you don't have iodine, iodine is the raw material. You take thyroid gland as a factory. Iodine is a raw material. It mixes with the protein and forms triiodothyronine and thyroxine, T3 and T4. These hormones are very vital, especially when the child is in mother's womb, or it's most important for its brain development. 90% of the human brain gets developed from the third month of pregnancy to the first 3 years. 90%, I repeat, from the third month of pregnancy to the third year of life, 90% of the brain development gets completed. So it's vital to have iodine in diet, and we are promoting iodized salt for it. And that's where I sacrificed, that's how I contributed. I would say I got blessings in this life. I've been working in this area for the last 43 years. 43 वर्ष काम करता है. 43 years promoting a very simple solution, but with a major socio-economic development implications. So that's number one, because if your brain and body doesn't get developed, आपका जीने का क्या? It's a compromised life that you're losing. And I must tell you, Rajendra Bhai, in this novel COVID-19, the most successful program in the world today is India's program towards universal salt iodization and iodine deficiency disorders. Today, 93% of India's population is consuming iodized salt. I repeat, 93%. With India's population of 1.38 billion, 93% occurs to 1.25 billion population. United Nations, as you know, has 193 countries. I made a list. The population of 193 countries is 1.25 billion. So in a way, we are reaching the United Nations 193 countries. It's a global public health success story in the field of nutrition. And the solution is very simple. It's a classical example of public-private partnership for the public. Because no country produces salt or iodized salt, it's done by the private sector. And I've been able to bring this public-private sector into public. I myself have made salt. Salt is a crop, as you know, it's harvested. You studied in IIT Powai, Mumbai. You saw a lot of salt works there. So I was a salt farmer. I'm a farmer's son. I also did salt farming. So I have not only established sound scientific reason, not only talked to policymakers like late Mrs. Indira Gandhi, who in 1984 took a decision of universal salt iodization, but I got equally involved in the implementation of the program as well. That's where I feel I'm very blessed to contribute to a major problem of mental retardation and physical deformities. भगवान ने मुझे इस जन्म में अच्छा मौका दिया है लोगों की सेवा करने के लिए. It goes beyond India. It's global. And I'm so proud and privileged to get this opportunity in this lifetime. To get this opportunity. धन्यवाद देना चाहता हूँ. धन्यवाद.
Thank you. Thank you. Dr. Pando and Dr. Banerjee, I think we are almost at the end of our dialogue and useful exchanges. I'm very thankful to you. And I'm sure this dialogue will go down as one of the webinars that we conducted, where engineer was in face-to-face with the medical giants. So I learned a lot today. I just wanted to tell Dr. Panda that I also harvested salt. I was in Tata Chemicals in Ithapur, and we used to carry, at least I used to ask my other engineers to carry with them a typical bottle from where we will sprinkle on a salt in a very small, very small quantity to get it iodized. And the Tatas were first to start manufacturing in a big way iodized salt.
At Mithapur.
Mithapur, correct. And I think the only mistake which we did in Tata Chemicals is that we used that salt mother liquor after harvesting for producing chlorine and caustic soda and bromine. That's such a horrible, at that time I used to love chlorine and bromine, but they are one of the horrible halogens which has created a lot of problem. So I would like to thank you, Dr. Panda. As usual, you would have the last word.
Thank you so much for calling me the Iron Man of India. I'm not only iodine, but iron as when it comes to having defense against COVID-19. That's why now we're introducing double fortified salt, which is fortified with iodine and iron. Thank you very much. Now, it's a new name that you have given me. You're a social engineer. You're a precision social engineer, because you asked us excellent pitting questions to us. The most difficult thing in life is question. To ask a question is the most difficult thing. So thank you so much for being such a exciting and such extraordinary and exemplary host for this particular webinar. Thank you so much. Bade bhai, Rajendra bhai, namaste, namaskar, namaskaram. कोरोना ये क्या किया तुमने चमत्कार. कोरोना क्या किया. आजकल सारी दुनिया करती है एक दूसरे को नमस्कार, नमस्कार, नमस्कार.
I would like to thank Dr. Banerjee and also Dr. Punit Misra.
Thank you, Dr. Sundar.
Thank you very much.
Sir, can I ask some question? Hello?
Yes. Do you have a time to ask to take some questions?
Only one word I would like to tell Pandavji.
Haji.
Yes, madam.
Okay. Good morning, sir. I'm Dr. Kanta from SRM IST. We have a good collaboration with the SECN. I really appreciate, and you, the word which you told was the blessed. Yes, you are the blessed man in the earth, because you could connect our ancient scriptures with the present knowledge, and you could bring out all the ancient knowledge, scientific knowledge relating to all the things, especially including the salt. I think when we go to a new house, we always take salt and turmeric. All those technology has been inculcated in that. And I would like to suggest one thing, because recently for all the courses, the AICT has included the Indian traditional knowledge. It has to be a paper in their curriculum. So probably you could talk to concerned people, AICT. I think Rajendra ji can work on that, because they are making it as a compulsory course, the Indian traditional knowledge system. So I request again Rajendra ji to work with him, so that we can incorporate our scientific knowledge in the ancient system into the traditional knowledge system, sir. Rajendra, you got my point?
Dr. Shendy, you're muted. Can you please unmute yourself? Dr. Shendy, you're muted. We aren't able to hear you.
Okay. Dr. Panda, go ahead.
I would like to give a second Dr. Rajendra Bhai, I would like to give a second commitment in public that I already have enough literature on me with me, which talks about ancient wisdom with respect to diet and nutrition. I have a presentation on that already, compiled from reading from Ved, Upanishad, and Bhagavad Gita. So I want to make a second public. I mean, your webinar has been superb. Two important commitments I'm making here today. One is the manual for diet and nutrition during COVID-19. And second commitment I'm making it publicly is that we'll prepare a manual about ancient practices for diet and nutrition. Second commitment. But of course, I need your help for that because you're a social engineer. You ask a smart question to smarter people.
So we are here.
Sir, actually, AICT is inviting people like you to contribute to the engineering lessons, sir. The
Right, right. So
syllabus
Yes,
we will-
madam. Answer is yes. I'll do that.
Yeah,
Okay,
Rajan,
But I require engineers. I require social engineers' help to take it forward.
Okay, we will definitely help. And SRM Chennai is a huge institution doing excellent work in sustainable development goals. And we have this project for the linking the universities and creating a network of colleges and universities for carrying out similar kind of work. And that is our objective. So thank you to all of you. Atharva, who has organized this webinar and a dialogue, thanks to him and his team, may I request everyone to on their camera so that Atharva can take a photograph. Can everyone on their camera in next 1 minute, quickly? Great. So Atharva, you know how to get all of them into one picture?
Yes, sir, I'm on it.
Okay, just go ahead. We have almost all. We have still some couple of them left.
Rigved,
Yes.
Yajurved, Atharvaved, and Samved. Back to you, Atharvaved. Atharva, you're our anchor now. Rigved, Yajurved, Atharvaved, and Samved. Back to Ved. Atharva.
Yeah. Dr. Poonam, Chitra Nair, Neha, Berbeth, sorry. If you can make it on, we take a photograph to publicize it, that we are all with Dr. Banerjee, then Dr. Pandav.
And Dr.
Exchange
Puneet
this-
Mishra and Dr. Sanjay Rai. We'll add their photographs as well. My esteemed colleagues
Right.
from the All India Institute of Medical Science. I heard the All India Institute, not All India. It's the.
Okay, okay. And we will have a similar
It
event.
deserves to be like that.
Yeah.
It deserves to
Right.
have the affixed to it.
Yes. So Atharva, did you manage it?
Yes, sir. Yes, sir.
Okay. So thank you all. Bye. Take care.
नमस्ते, नमस्कार, नमस्कारम. इस संवाद के लिए आपको धन्यवाद. इस संवाद के लिए आपको धन्यवाद. Precision Social Engineer Dr. Rajendra Shende.
Okay. Thank you, Dr. Banerjee.
Thank
Bye.
you, sir. Thank you.
Thank you all, sir.
चलो बहुत अच्छा गया.